Claire, you're on mute.
Thank you. Sorry. Good afternoon, everyone. I'm Clare Capito. Welcome to our second Capital Midwife webinar. In a moment, we're going to show you a short video of the work of the Capital Midwife programme. And following that, I will give you a brief overview as to why Capital Midwife is growing a culture of kindness and its importance to the programme, which will then lead us on to hearing from Gabby Bambridge, our guest speaker this afternoon. Thank you. So let's have a look at our video.
Capital Midwife. In London, there are approximately 5,700 midwives and 130,000 births per year. Capital Midwife has been developed in response to the growing need to apply once for London solutions to the challenges faced by London midwives. Our main aim is to ensure every Capital Midwife is valued, respected, listened to, and supported to reach their full potential. London midwives are passionate about their job. They told us they love caring for mothers and their babies from all different backgrounds. That's why Capital Midwife has developed products in partnership with midwives and student midwives to support the London midwifery workforce. Our preceptorship programme framework ensures all London midwives have support and guidance at the start of their career. The Midwifery Skills Passport includes an up-to-date record of a midwife's professional development. It's simple to use and can be updated on the go. We also created a midwifery workforce survey in partnership with King's College London to hear from London midwives about their experience of working in the capital and inform future Capital Midwife activities and products. We would love to hear your thoughts on how you think Capital Midwife can support the midwifery workforce across London or in your place of work. So get in touch. Every London midwife is a Capital Midwife.
Thank you very much.
Capital.
So next slide, please. So as Capital Midwives, we've been developing our programme to enable our midwives, particularly in London, delivering excellent care at all times. And in 2019, we undertook a survey of all London midwives and their experience of working in London. And what we came across were some results which were quite worrying. In terms of over half of the midwives surveyed said that they experienced personal harassment or bullying whilst at work. Some of that was reported from patients, and 30% reported from colleagues and managers, and only 20% of these midwives felt that they could report this. So that set us to thinking that we needed to start thinking about growing our culture of kindness, and this idea started to germinate. And can I have the next slide, please? We had our first webinar in February, and some of you may have actually been attending that, where we looked at growing our culture of kindness, but also what can we do about it in terms of reporting it. So we had Dr. Henrietta Hughes, who's the National Guardian for Freedom to Speak Up. And these are some of the comments that you made about that webinar. And I think it was really important to hear that students felt that their voices mattered, that it was important to be kind and to listen, and that the incivility links that we talked about was powerful for newly qualified midwives to understand. Good to know about other Freedom to Speak Up guardians exist in the trust, because many of the midwives didn't realise, or many of the people who attended didn't realise that Freedom to Speak Up guardians existed. Can we just go to our next slide, please? And we also launched our campaign to have growing our culture of kindness and getting you to nominate a Capital Midwife you felt had all those characteristics of growing our culture of kindness. So just looking at, we've had 3 or 4 nominations, but this is just a selection from the first ones that we received. The first one from Sam, this is actually about Victoria Cochrane, who's one of our directors of midwifery at Chelsea and Westminster. So she says that she nominates a true capital midwife. Throughout this pandemic, she's supported staff and women, ensuring all voices are equally heard. And Aisha from Epsom and St Helier talked about all her colleagues in the maternity department being so kind and welcoming to her, particularly as she was a newly qualified midwife, and she's proud to be part of the team. And Shireen from North Middlesex said, how can I possibly only nominate one capital midwife? She's nominated all her staff at North Middlesex because they've been adaptable, kind, committed and passionate about ensuring women and families continue to receive the absolute best. And we even achieved baby friendly level 3 in the midst of it all, which is fantastic. And then we have, could I have the next slide? We have a posthumous nomination for a very special capital midwife. Geraldine, many of you may have met Geraldine whilst working as a midwife. She was a midwife at St Thomas's for very many years, and very sadly she died in February, but she was very much a capital midwife. Can we come to the next slide, please? So why are we wanting to look at kindness? And I've already explained in a way, but equally, and I know Gabby is going to expand on this, so I'm not actually going to dwell very much, but this is about kindness, civility and safety. And studies have shown that where people are rude and disrespectful, safety is compromised. And civility, or being kind and nice, may feel sort of fluffy and tame and safe, but actually when you don't have it in a work culture, you start to realise its importance in safety. So can we have the next slide, please? When particularly some papers or documents that were published, reports were published last year, particularly this first sentence, poor behaviours and hierarchy may influence staff ability to make sound decisions and result in a reluctance to escalate. And again, Gabby's going to go into that in much more detail. And the much more recently published Ockenden report in December also talked about, looked at maternal and neonatal harm, and particularly showed there was a lack of compassion and kindness in staff. So let's have a look at the next slide. So just as a short personal story, this actually did happen a very long time ago, but it really influenced how I felt about things. And so when I was a student nurse, and I know it sounds a very long time ago, about 40 odd years ago, I was learning to be a scrub nurse in theatre. And I think I was working with a very impatient surgeon, and I was just counting the swabs. Anyway, I got wrapped on the knuckles with a diathermy forceps. I mean, the sister who I was working with was sort of ticked him off, but it stayed there with me for quite a long time. And actually, I really didn't want to work in theatres for a long time. I did end up working in theatres, but that was much, much later on. And I just think many of you perhaps can relate to incidents of incivility and how it made you feel. And for me, it made me feel that I just didn't want to be there. And anyways, we're going to now be talking a little bit more in detail. And could I have the next slide? Because I'm going to be introducing you to our guest speakers. Gabby is a consultant obstetrician at Kingston Hospital. She's absolutely passionate about human factors and how that impacts on safety. And she's going to be assisted by Vanessa, who's a midwife and a clinical matron and fetal monitoring lead, who also recognise that actually education alone doesn't prevent poor outcomes, that it's relations, it's human factors that are important. So with not much more ado, I'm going to actually hand you over to Gabby. So thank you very much, Gabby, for coming to speak at our webinar.
Okay, no, thank you for having myself and Vanessa, Claire, and thank you for giving us half an hour really to talk to you a little bit about our human factors journey at Kingston, and particularly focusing on developing that culture of kindness. Can I have the next slide, please, Tazzy? So the changes that we've seen at Kingston didn't happen overnight, and we're not perfect, and we're certainly not at the end of our journey, and we probably never will be. Our journey, like so many journeys in healthcare, started with tragedy. In 2015, I was appointed as a new consultant at Kingston, and I was lead consultant for labour ward. And within my first year of being a consultant, we had 2 preventable term early neonatal deaths on the unit within a couple of weeks of each other. And I was actually one of the doctors involved in one of those cases, and I experienced firsthand not only the devastation it caused to the families, but to me personally and to the other healthcare professionals involved in these cases. Next slide, please, Tazzy. And it was about the same time that this picture went viral on the internet, and it very much summed up how I was feeling at the time. And for those of you that haven't seen this picture before, this picture was taken by a paramedic outside a Southern California hospital, and it's a picture of an ER doctor crouched down against a concrete wall, grieving the loss of a 19-year-old patient. And frequently we feel personally responsible for the outcomes of our patients. And I know that's how I felt about this woman who lost her baby. And this was the first time that I started looking into the effect of adverse patient outcomes on the staff involved in their care. And it was certainly the first time in my career as a consultant that I heard about the second victim, with the second victim representing the healthcare professionals involved in unanticipated adverse events, medical error and patient-related injuries. Next slide, please, Tazzy. Many people commented on the photo, and one person said this: "I know what that person is feeling. Yesterday, one of my 17-month-old patients died. I was in the bathroom crying in private between patients several times yesterday. I've cried in stairways and hallways. It eats you up. Life is fragile, and the pain of losing those we're trying to help becomes a scar that doesn't go away. It has shaped who I am as a person." And it really struck home with me. And I know that certainly we can probably all think of times where we've taken a moment by ourselves, locked ourselves in the bathroom, in hallways, in hospitals, and cried over patient loss. Next slide, please. And there's a perception that when you become a midwife, a nurse or a doctor, that actually we should be immune to everything that goes on around us, and that we shouldn't share our distress, but hide it away and brush it aside and carry on with our day. But actually our patients want us to be human, and they want us to acknowledge that unexpected death is universally heartbreaking. Our patients want us to cry with them, and some of my best patient relationships have been developed through that expression of raw empathy, sharing that distress at loss, but actually then getting to share the joy when they come in subsequent pregnancies is a real privilege as a midwife and an obstetrician. Healthcare professionals who are not allowed to grieve or express emotions get sick. They get depressed, they feel anxious, they suffer from PTSD, they turn to substance misuse, and some will even contemplate suicide. And this really needs to change, and it starts with an open, kind culture. Next slide, please, Tazzy. So probably like so many of you, we have a weekly meeting at Kingston on a Friday morning between 8 and 9 called the Big Room. And it's where we not only discuss resource, equipment, process, etc., but we also use it as a snapshot to gain insight into how people are feeling at work. So we'll pose a question like, what makes a good day at work? Or how did you feel last night going to bed knowing you were working today? Next slide, please, Tazzy. And we sort of get this word cloud generated. And quite often, you know, what makes a good day at work? People have written teamwork, not too busy, leadership, nice staff, coffee, being able to take our breaks. No one's written that they've come to work to try and make somebody cry. Next slide, please. So what is incivility? If you just next slide, please, Tazzy. So incivility is a spectrum of behaviours. Claire, you very much sort of described a physical violence of sort of an unkind behaviour of someone striking you with a surgical instrument, but sometimes it's not as obvious as that. And more often than not, it's the non-verbal behaviours or the whispering behind each other's back that have the big consequences in making your work environment unpleasant. Next slide, please, Tazzy. And here's just a few facts that some of you might have seen before about incivility. So what actually happens to you when someone's rude to you at work? So 80% of people will lose time worrying about rudeness. So that's a worry that we carry around with us a worry that distracts us from caring for our women at work, but also a worry that we take home with us. The worries that keep us awake at night, the worries that stop us interacting with our families and listening to our children when they come home from school. Next slide, please, Tazzy. 38% of people will reduce their quality of work and 48% will reduce their time at work. Next slide, please, Tazzy. And actually, bullying and undermining behaviours account for, account for 10 million working days lost in the UK each year. And if you think about your units at the moment, certainly in the pandemic, sickness has played a huge part in sort of mental well-being and stress at work because of sickness through COVID. So if we can reduce sickness through incivility, it would make a real difference. Next slide, please, Tazzy. More worrying that 25% of people that are subjected to bullying or undermining behaviours at work will take it out on service users. If you hate working somewhere, then you will miss things. And sadly, in negative work cultures, those women are at increased risk of poor outcomes for their pregnancies and their babies. Next slide, please, Tazzy. Again, even more worryingly, you don't have to be the victim of the bullying or the undermining behaviour, but if you witness it, you're more likely to decrease your performance at work, and also you're less likely to help others that you work with. Our women, our families that come into our units, this may be the first time that they've been into hospitals. And so we're very much under the spotlight. They see the way we talk to each other, the tone we talk to each other, and our body language. And they will pick up on a negative work environment, and they'll be less enthusiastic about the places we work. So incivility not only affects the recipient, it actually affects everybody. Next slide, please, Tazzy. As a medic, I like a good study, and in 2019, this study was published in the BMJ, and there was 2 theatres and the same simulated operative crisis. In one theatre, you had a polite surgeon. In the other theatre, you had a rude surgeon. And having a rude surgeon reduces your anaesthetist performance by about 1/3. But probably more worrying is that when the anaesthetists that were subjected to the rude surgeon were asked about their performance, they didn't recognise this. Next slide, please. So the big question, are you a nice colleague? So when I go to work, I go into work trying to think about be positive. My aim is to look after the women on the labour ward, look after their babies, but also to provide training for the students that I'm training. An hour later, I can quite easily, and Vanessa will back me up on this, become Jurassic Gabby rather than Toy Story Gabby. And I had a real sort of eye-opening moment, it must have been a couple of years ago now, where I was in a room with a woman and the registrar came in and was really quite rude to me. And so we left the room, went into the office, and I was like, well, what are you doing? You can't talk to me like that in front of a patient. She just turned around and said, well, you've spoken to me like that all day. What do you expect? And there was that real moment of, actually, we all think we're nice colleagues, but there's times where we do turn into Jurassic Gabby, and my colleagues need to feel bold enough, brave enough, and comfortable enough to say, actually, Gabby, are you okay? Do you need a cup of tea? Next slide, please, Tazzy. So understanding yourself and knowing your strengths and areas for improvement and recognising how your behaviours will impact others will make you a better clinician. Next slide, please. So where do you start? And I know that when we sort of started talking about kindness culture, etc. at Kingston, we didn't really know where to begin because we all assumed that we were nice people and nice colleagues. So we looked, as you do, on the internet, and we came across the Clark Workplace Civility Index as a way of self-reflection. And basically, it's a series of questions where you grade yourself as always, usual, sometimes, rarely, or never. Next slide, please, Tazzy. And originally, this was supposed to be confidential, completely anonymous, but what we found is that actually generated lots of conversation. And when I was looking through the list, I found that I was actually quite guilty of quite a few things on that list. For instance, I'm an obstetrician, but I attend the obs and gynae senior team meetings. And so quite often I would zone out when they're talking gynecology and maybe be on my phone or distracting one of the other obstetricians. So it was a real eye-opener for all of us filling in this questionnaire. And there are other questionnaires out there. This one very much focuses on you as an individual, but there's ones that you can use that talk about your workplace and your workplace environment. And we haven't done this for a while at Kingston. And sort of preparing for this talk made me think that actually we should probably revisit whether we've slipped back into old habits, because there's always room for improvement. Next slide, please, Tazzy. So treating each other with kindness and respect is really fundamental for establishing and sustaining healthy workplaces and building that top performing team, not only to protect our patients and keep our patients safe, but actually keeping ourselves safe, particularly safe from mental illness. Next slide, please, Tazzy. So creating a culture of kindness. Next slide. So one of the first things we did was to lose the formalities. It's really archaic to call a doctor Miss or Mr. And we need to dispel the myth that you need to be called Miss or Mr. to be respected, or that it shows respect. Everyone at work calls me Gabby. And if anybody does call me Miss Bambridge, it's either because they don't know my name, and so I would introduce myself to them. They're from some formal institution like the bank, or they're talking to my mother, and therefore I tend to ignore them. Using my first name and using each other's first names really levels the playing field. Those of you who've worked with me know that I was a registrar at Kingston for a long time. And when I first became a consultant, I found the transition really difficult. And I would call my now consultant peers Mr. Pooley, Mr. Annim. And by doing this, I was immediately establishing myself as younger and less experienced, and also of lower status, which wasn't particularly helpful to myself nor my patients. So I encourage you all to confidently use other people's first names and your own first name, as this does establish you as mature, confident, and does minimise that status gap. Makes you more accessible. And when we're talking about Jurassic Park Gabby, if people know me as Gabby, they'll stop and ask if I'm okay, which is really important. Next slide, please, Tazzy. So if anything good has come out of the pandemic, it was probably the introduction of the wobble rooms. And you probably have seen these sort of nationwide, and they're certainly trust-wide, and we have our maternity wobble group. You can either come into the wobble room and talk, or write down your worries and then sort of rate your worry. One of the issues that I have with the wobble room is that when I get stressed, I don't want to cry. And I think wobble makes it sound like you have to go in and have a cry. I get mad. So I don't know whether Sarah Salinger's on the call. She's our PMA. Her room's very much become my rage room. So I'll go in, I'll shut the door, I will get what's frustrating me off my chest. Sometimes I'll write it down on what we like to call the rage page. And then if it's important, I'll compose myself and action it. If it's a silly rage, it gets ripped up and thrown in the bin. As a mother of 2 girls and of a wife of a non-dishwasher emptier, we have a moan and move on page at home. Next slide, please, Tazzy. Oh, Esme, go away. Esme, go away. Sorry. So we realised that actually the wobble room is great, but not everybody has access to the wobble room. So we set up a virtual wobble room, which was really easy to access. We used Padlet, which is an app which you can get onto via your phone. And one of the benefits we felt at the time was that it was anonymous. Next slide, please. as always, whenever we introduce something new, we want to gain feedback from our team to see whether it's working. And somebody wrote this. So I think the theory of this is great, that staff are given a chance to air their concerns. However, when 50 minutes of the big room is dedicated to talk about change in policies, etc., and only 10 minutes to staff views, it makes a bit of a mockery of it. This is clearly not enough time for staff to feel supported and feels like lip service. This is a shame, as to the staff on the shop floor dealing with these patients every day, feeling burnt out with little support. And this really made us take stock and think, well, how can we make this better? The issue being is that the wobble room concerns were discussed at the big room, and not everybody can attend the big room. But using the Padlet format meant that we couldn't reply to people's individual concerns because we didn't know who they were. Next slide, please, Tazzy. And this sort of led us on to think about the benefits of anonymity. And when we first set up the wobble room, we thought it was really important. But actually, anonymity in itself can lead to incivility. And people tend to be maybe braver, a bit ruder, and say things sort of anonymously on chat groups that they wouldn't necessarily say face to face. And even seeing something written down has the same impact on sort of productivity and performance of a team as it does if you said it face to face. But we really thought that the virtual wobble room was important. So we had a rethink. Next slide, please, Tazzy. And so we set up a different type of virtual wobble room. And we use Teams at Kingston, like lots of you probably do. And we've got a maternity big room challenge, which every member of our maternity team at Kingston is a member of this. And we have this communications board. You can still be anonymous if you choose, but we encourage people to use their names, or at least simply put their role there. And one of the benefits was that the big topics that we couldn't cover in the big room would be taken outside, maybe into a smaller group, and you could respond and put where things were with regards to comments. So if people weren't able to attend, they could have a little look in and be like, oh, OK, Gabby and Vanessa are looking at that. I'll go and find out what they're doing. And we also encouraged people to share positive stories, because what we found is there was lots of negativity, and actually it sometimes does feel a little bit doom and gloom at the moment, but lots of good things. For instance, the Capital Midwives webinars, there's lots of good things going on. So sometimes it's really important to sort of shout about those successes too. Next slide, please, Tazzy. And alas, we got a good comment, and it was just simply that listening, acknowledging, and the action of the comments that were put on the board that led people to think that this was a much better format. Again, it's not perfect, we're still working on it, but I feel like we're getting there. So next slide, please. So people's positive experiences come from being listened to, and then having somebody who empathises. And I think in 2021, one of the most important leadership skills that you can have is empathy. So listening to someone and truly listening to them and understanding the way they're feeling, even if it's different to the way you're feeling, is really, really important. Giving people the freedom to speak up without fear of ridicule or backlash, or no one wants to say negative things about their unit, but genuinely saying thank you to the people that are working so hard at the moment. And at the end of the day, we know that happy staff are safer, they're more productive, and they have less time off sick. Next slide, please. So calling out people for bad behaviour. So bullying and undermining is a cycle, and the person who's doing the bullying is trying to exert control over another person, and this may stem from them being bullied themselves. The impact on the person being bullied is they become anxious, they socially isolate themselves, and as a result become increasingly vulnerable. And then this feedbacks to the person bullying that their behaviour is working. And it's really easy to get inadvertently drawn into the cycle as an outsider, and that's how a bullying culture develops. Next slide, please, Tazzy. So calling out people for bad behaviour is absolutely terrifying. It really is. And it's something that I struggle with because, believe it or not, I'm not a confrontational person. And when I witness unacceptable behaviour, my natural instinct is to want to leave it, to do nothing. It's nothing to do with me. But silence is an act of complicity, and meaning to remain silent while someone is being bullied is to be complicit in the bullying and is as bad as being the bully. Next slide, please. So if anybody has a spare 20 minutes in their life, I would really strongly recommend reading Amy Cuddy's TED Talk. So Amy Cuddy gives a really good TED Talk on how we shape our bodies, the way we use our bodies helps us be more confident. And she does it from a job interview perspective, but actually it works in this kind of situation as well, a sort of fake it till you make it. And you might have heard about power posing before big interviews. Quite often, if I've got a difficult conversation to have with somebody, I'll take a few minutes, do a little bit of a power pose, which is great and so Grey's Anatomy, but it means that actually I have the confidence to go to that person, maintain eye contact and be calm and collected. Something that I found helpful is the person who has experienced the undermining behaviour, getting them to write down what happened and how it made them feel, and then going up to the person who has said the unkind comment and sort of just showing them in black and white what they did and how it made that person feel. And 9 times out of 10, that person is absolutely mortified. You know, I've had someone come up to me before and say, you were a little bit rude the way you spoke to the student midwife on the birth centre or whatever. And I felt, you know, and she came back quite upset, and that makes me feel awful and makes me go and rectify it. Next slide, please. So it's really important not to ignore bullying. And in the last webinar, they talk about speak up champions. It's important to know about who those are in your trust. And if you wanted to sort of speak to somebody outside of your trust, certainly on a regional level, there'll be speak out champions on a deanery level for junior doctors and at the RCM as well. So it's important to remember that civility saves lives. Next slide, please, Tazzy. And just some sort of real strong facts to end on. 1 in 5 doctors are treated for depression. 1 in 4 doctors have contemplated suicide. Next slide, Tazzy. And 1 in 50 doctors has attempted suicide. To put that into perspective, I work in a unit where there's probably 50 obs and gynae consultants and trainees, and I find those statistics quite shocking. So moving on now, next slide, Tazzy, for questions, comments and ideas on our sort of whistle-stop tour of kindness culture.
Thank you very much, Gabby. That was fantastic. Now, I have to say, people have been very shy. They've been very busy listening, but they haven't written any questions in the Q&A bit. So we would really love to hear any more. There is a comment from Kate Greenstock saying, completely agree with Gabby about sharing raw empathy. And I think that struck a chord with probably quite a lot of people because it was liked. And I was just wondering, I mean, we have a constant discussion with our PMA, so that's the Professional Midwifery Advocates, and our monthly support network, and talking about calling out bad behaviour and how we support staff. And I think that's really important. And I think your suggestion about how one stands is really, you know, how one's body language to meet that, because it can be really difficult to sort of approach someone who is not behaving very well. Also, the other thing we were thinking about is someone is feeling a bit off, and you've witnessed someone behaving badly or being a bit grumpy and not being offering a cup of tea. Now we had this debate, and I don't know whether there's any thoughts in the audience here, but actually can we be brave enough to go and offer that person a cup of tea? Personally, I think that behaviour is saying, you know, I think we do need to offer something, that person is obviously struggling a bit. I don't know whether you've got any thoughts about that, Gabby, or whether you've experienced anyone offering you a cup of tea.
I mean, it sort of goes back to whenever I think about sort of how I behave on the labour ward. It goes back to I think about the Holt campaign that they had at Tommy's, you know, the hungry, angry, late, tired. And 9 times out of 10 with me, it probably is hungry. Because, you know, you have your breakfast, you get to work, and when it's busy and chaotic, you don't drink, you don't necessarily eat, or you eat, you pick on bad things for you, you know, things that aren't going to sustain you throughout the day. So it would work. Anybody that works for me, it would work. Definitely. And I know when you come out of theatre sometimes and someone just hands you, you know, a cup of coffee, just someone knowing what your coffee order is really touches me sometimes.
Yeah, that's fantastic, isn't it? Very, very good. We haven't really got any questions in the chat box yet. I don't know whether there are any thoughts or has this completely, has it hit the mark or not? Just be useful just to get a little bit of feedback if you're happy to do that.
I think Vanessa's got a question.
Okay, Vanessa. I don't know whether you need to come
Sorry, I don't think it was a question. I'd just like to say that at Kingston we're really lucky with the local community, and since we've been you know, the COVID restrictions, the local community have given us an awful lot. And I share the office with Sarah, who's our PMA, and we've been given goodie bags to give to midwives that are just feeling a little bit under stress or under pressure. And they include things like chocolate, bubble bath, colouring pens, colouring books. And it's absolutely amazing to be able to give this to staff because it makes them feel really valued. They've also given us a coffee machine with coffee pods. So, you know, we go and do coffee, or Sarah does especially, does tea and coffee rounds at least a couple of times a week with biscuits and cakes that we're also given. And I think it does make people feel better.
Fantastic, thank you. I think I totally agree with that. There are some questions now. Thank you everyone for helping us with this. There's a question about your communication board, Gabby. Who coordinates that? I think it's a brilliant idea, especially with the addition of an action section, and that's also been liked as well.
So at the moment, that's me. So you know, one thing that people didn't like about Padlet was it felt like you wrote it and then nothing happened to it. And so we sort of sat down and decided, well, what would be the process? It needed somebody to be looking at it. So I probably look at it at the beginning of the week, midweek, and then just before Big Room. Anything that is appropriate to discuss at Big Room, we discuss an action there. Anything else, we sort of will say, well, we'll take that outside. So it's me at the moment that coordinates that. But I do that along with Sarah, who is our PMA, particularly the ones that are more support and well-being and that kind of thing. So that's me.
Lovely. And there's a question about the wobble room. Was it called something? Is it still called the wobble room, or was it called something else in the end? Sorry, my reading.
So this is the PMA office.
Right.
And I share that office as well, so I can wobble on out of that room if need be. But it's still called the wobble room, and this is where the coffee machine is. So and there's a chair, a nice comfortable chair in the corner. And you know, we do have it. It's not just midwives, it's doctors, anaesthetists. We've had domestics, support workers. You know, we have quite a lot of people that do come into that room. You know, we've had tears and laughter. And don't get me wrong, you know, it's not that people aren't there all day long, but people know they can come in, they can shut the door, they can have a little wobble and off they go.
Yeah, very good idea. Fantastic. There's another question here, and I suppose it's a philosophical question, really. Why do some maternity units nurture and harbour bullies? When these bullies are challenged, they are supported by the midwifery management team. I think it's a difficult question to answer, really. And I think the whole point of this campaign, and I really do believe, you know, this Capital Midwife, growing our culture of kindness, is not just limited to midwifery. This is actually, you know, it's now being talked about within Ockenden, within, you know, the current, we know that incivility, as Gabby very eloquently demonstrated, causes a unit to, or a work environment to become unsafe. So I think nowadays management teams are beginning to recognise that we need to do something about this. We've got the Speak Up for the freedom to speak up. That we should be using all of those. It's so important, and I also know how difficult sometimes it is to call these things out, but actually it's really important that we do something about it. I don't know whether either Vanessa or Gabby have anything further to add to that.
I think it's really difficult, but actually the more people talk about it and the more you say that that's not okay, it will change. It's not going to change overnight. It doesn't happen like that. But it's just making it the norm to be like, actually, that's not okay to talk to that person like that, and doing it timely. So if you see it, just go, Vanessa, the way you spoke to James was actually not on, you know, and then so it's about being timely in your feedback, not leaving it, 6 months till you're doing a 360-degree appraisal and nobody knows what you're talking about.
Yeah, I totally agree. And I think that's the whole reason why we've set up a series of webinars. Because pre-pandemic we were going to totally dedicate a conference to this, to creating a culture of kindness, but actually maybe the series of webinars, so this isn't a conversation that finishes today, we have got some ongoing webinars. We want to continue the conversation because this won't happen overnight, and I think it's really important that it's constant in our conversation. So a really good comment and question, Joy. Sandra, nice to see you here, Sandra. Even if we don't offer a cup of tea, we can ask the person if they're okay, and that's a really good comment. You're absolutely right. All right, let's have a look at the next one. Croydon PDM, fantastic presentation, very thought-provoking. Do you teach human factors to all staff? If so, what resources do you use? E-learning available?
Yeah, at Kingston, 8 of the education team went on human factors training course, and that myself and Gabby were included in that. And I think the way that you change culture in a unit is to embed human factors in everything that you do. You know, all of your training, all of your handovers, all of your risk reviews. It should just be embedded into that culture. You know, as Gabby said about calling people by their first names, you know, this is all human factors, but it's having the understanding of what human factors is, because if you don't know it's there, that's when it causes you a problem. But we don't have specific online resource.
Thank you. Okay, that's brilliant. Thank you, Vanessa. Now there are a couple of questions here which sort of again lead to a culture, not a very healthy culture, about behaviours of groups and teams of people together. How do you address the behaviour of a group of people who have the ability to give you feedback that might be used to get back at you? And I'm going to respond to that in a minute, but I also just want to look at the next question because it's sort of on the same theme. Really a fantastic presentation. Have you got any thoughts on shifting a whole team culture? When leadership isn't willing to change a team's culture, it's really hard. And I think both of those are the same theme, really, trying to change a whole team. And again, I think this is about everyone becoming knowledgeable about culture, about what is good, understanding what incivility is, eye rolling or whatever. An example I can give to you was many years ago. I was on night duty and a tray of tea was brought into the room, and I knew that I hadn't been asked for tea, but everyone else got a cup of tea. And I decided I just would call it out. And I said, oh, is there a cup of tea there for me? And they were so embarrassed and so, well, almost ashamed. I didn't need to, but the point is, I think we have to address it as we sit. And it is very difficult. It could have been very undermining for me to just ignore it and think, oh, they're just being horrible to me. But I decided no. And I think there is something, we do have to call it out. We do have to break down barriers. And I think that one of the first things is to break down the hierarchy as well. And I think Gabby's illustration of wearing her visor with her name on the front is really important. And again, I can give an example that when I was a consultant midwife on the board, if I was in a room looking after a woman in labour, everyone couldn't cope with me. They'd either call me Nurse Capito, and I said, well, I'm not a nurse, I'm a midwife, or they'd call me Midwife or Mrs. Capito, and I said, I'm not Mrs. Capito, I'm actually Mrs. Dobson. I said, I'd like to be called Clare, please. Is that okay? And it was very difficult, and that was an organisation that was quite hierarchical. But that's fine. We got around that. Any thoughts, Vanessa?
Yeah, Claire, can I just say, when we introduced physiology to our fetal monitoring interpretation at Kingston in 2015, we had quite a lot of resistance from senior clinicians, and we found that the best way to change our culture of how we interpreted CTGs was to start from the junior midwives that were coming through, the student midwives that were coming through, the band 5s, the band 6s. And when everybody else embraces a different culture, the people at the top are left behind. So you'll find that they do catch up in the end, but you have to get leaders are also leaders at band 5 and band 6 as well.
Yeah. So this is about champion change. Yes, Gabby, I can see you've got your hand up.
And when people are talking about sort of changing cultures, or trying to change group mentality and how to do it, sort of drip feeding it in, because what we found is that human factors, some of my senior colleagues just thought this was the fluff. This is the fluff. You need the knowledge, Gabby, to be a good obstetrician, not the fluff. And so we weren't necessarily given the time or the resources to do it properly. So what we did was just infiltrate pre-existing meetings. So, big rooms happening, but now we've infiltrated big rooms. So we have 5-10 minutes where we sort of do a little bit on either how staff are feeling or do some reflection from the communications board, that kind of thing. And when it's there in front of you in black and white, even the most senior people, you can only put it down to one individual once. When you're seeing it repeatedly, it has to be acknowledged. So just to infiltrate meetings that are already happening, and just ask for 5 minutes and take a cup of, well, no, we're not allowed to do face-to-face anymore, but when we're allowed to do face-to-face, take a pack of biscuits, and you'll get people engaged. And with regards to, I think someone commented on how do you get the older members of the consultant team to get called by their first names, or older members of the team, just ask them. But I think when I first started a long time ago, I was like, that new trendy consultant that lets you call her Gabby. Whereas actually, when you say to your colleague, why do you want them to call you Mr. Such and Such or Miss Such and Such? And they're a bit like, they don't have a good answer. So then people just sort of think, oh, okay, that does seem sensible. Or present the evidence. There's lots of really strong evidence in business and in healthcare about the power of first names, particularly on the anaesthetic side.
Yeah, fantastic. I'm just going to make a big comment. We've got some fantastic questions here, and we don't have much time. We've got about 10 minutes. So I am going to I might cull some, but there's a really interesting comment here from Bernie saying, recently I've had a large number of students approach me about incivility they're experiencing. It's shocking that the way I was made to feel almost 40 years ago as a student is still going on. The work you've done is great, and I think there's a lot that we can learn from what you are doing. Thank you. So that's a lovely comment. Claire is saying, some really great ideas to assist with change in other hospitals. I do find there's a fear culture around challenging unkind behaviours from colleagues and senior members of staff, which is really sad but very real. Thank you, Claire. If a minority of consultants refuse to be addressed by their first name, oh, here we go. You've answered that one, sorry, Gabby. How do you see the midwifery team and their interaction with others during a chaotic shift? That's quite an interesting one. about chaotic. It is chaotic, and I think it's something about team, isn't it? It's about looking after the team, sort of touching base with people, saying, how are you getting on? Is everything okay? Vanessa, do you want to answer?
Yeah, so we're going to be introducing, so one of the next things we're going to be doing is a check-in and a check-out, you know, during each day, and I think that's really important. And I can see a lot of the comments about Band 7 coordinators, you know, that they're the ones that give the students the opportunities, and if they're rude, how do you address it? But I think the Band 7 coordinators should be very approachable, and sometimes because they're feeling stressed or they're feeling anxious, you know, the way they react, sometimes they don't even realise they've done it. But if we do a check-in and check-out, it just makes sure that in the morning, when we do our handover, we just ask, is everybody okay? Is anybody hungry? Is anybody, you know, tired? And then at the end of the day, I think it's so important to check out and to say, how was your day? Was there anything that worried you? Because we know that midwives go home and feel anxious about cases that they've had during the day. So if they've been given the opportunity to talk about it before they go home, hopefully they'll go home with a different frame of mind.
Yeah, thank you. That's great. There's a question and comment here saying, I really enjoyed your presentation, Gabby. Thank you. I've been off this past year thanks to COVID, and lots of the wellbeing things are slowing down from what I can tell now. I think the momentum for staff wellbeing civility needs to continue. How can our trust maintain these wellbeing rooms and your online boards? I actually think that we may think we're coming out of COVID. I actually know that from a national piece of work that's been happening, that actually people are concerned about staff wellbeing, and it will continue. We've got more PMAs being trained, so professional midwifery advocates, to support their colleagues in the workplace. I don't know whether either Vanessa or Gabby want to add to that. I personally feel that it should continue, and certainly we're going to work with the London PMAs to make sure that happens. Any other thoughts?
It's something that's really, really important to me, and certainly something that I will continue to champion at Kingston and have it on the radar. And all you need is and there will be in each trust, there will be a small group of people that will feel passionate about this, and it's about keeping the momentum going. Yeah. With regards to the chaotic labour ward shift, which is pretty much every day at the moment, it feels like, how do you sort of stay in control? And I think it's just taking, for me, it is just taking that 5 minutes at sort of short periods of time throughout the day, not letting it all build up, where I sort of just check in on how I'm feeling. And I know when I'm feeling anxious or I'm getting snappy or I'm feeling out of control, that something's going wrong. So that's my personal signal to myself to stop and regroup. And we'll have lots of little safety huddles throughout the day. And on a really busy, chaotic day, we might all, we might literally do it every hour, every 2 hours to sit, what's going on, who's had their break, who needs their break, how are you feeling? And then on other days, it might be that you only touch base 2 or 3 times a day, but that's about really sort of bashing down those barriers between midwives and doctors and nurses, etc. And also just to sort of comment on the person that says, what can you do if the band 7's the person that's being rude? It's, remember, there's a whole other group of people that you can go to. Like, I am more than happy for midwives, student midwives, MSWs to come up to me and say, I don't know what to do, I'm having a real problem with X, how can I deal with this? And I can help mentor that person through that scenario. Just because I'm a doctor and they're a midwife doesn't mean that we're separate.
Yeah, yes, thank you. We're sort of coming towards the end, and what I want to do is just read out a few sort of comments, and then we'll sort of, rather than do a last question, and what I would like to do is compile these questions, and if there are any that we feel that haven't been answered but we can provide an answer, we will send that out, because these slides will be made available to you all as well for everyone who's attended. And I think we've got a recording as well of today's presentation or webinar as well. So there's lots of thanks for the presentation. Fantastic presentation with lots of food for thought, some great ideas which I will suggest to trusts that I work with. So So true about leading from the ground up with a "that's not okay, thank you." I agree with Vanessa, everyone is a leader. Something about infiltration. Drip feeding works really well. It's what's been missing in medicine for hundreds of years. So respect costs nothing, and everyone should give and receive. Thank you, Gabby. So that's the end. Thank you, Gabby and Vanessa. It's been a really fantastic webinar. I've just got a couple of notices that I wanted to bring, and thank you very much to everyone who's been here today. We had at one stage over 100 attendees, which is really fantastic. There is a link in the chat, and would you mind completing that for us? It's a survey. It's very brief, and it's just a matter of just quickly letting us know what you thought of today's chat. But I've seen some really positive comments here, so hopefully you've all enjoyed it. I want you all to think about who you'd like to nominate as a capital midwife, looking at if they've got all those lovely characteristics of creating this culture of kindness. We have social media accounts in Instagram, Facebook, Twitter, and we have obviously an email as well. So we have got some more webinars planned. The next one won't take place until probably middle to end of May, and there we're going to look at the professional midwifery advocates. We're going to look at it, perhaps getting some examples. And some of you I know because of the work I do with the PMAs in London, have some good examples of work that they do looking after their staff and checking in and checking out, as Vanessa was talking about. But and there's probably more that we can talk about. But if anyone has got some ideas and you would like us to talk about, in particular, focusing on creating our culture of kindness, I would really appreciate that. And I've just realised we're sort of finishing 4 minutes early, so I don't know, is it worth me just looking to see if there's one more question, or shall we call it an end? We've finished. All right then, thank you very much. Look, thank you very much, everyone. It was lovely to see you all. If you could complete the survey, that would be brilliant. And a huge thank you to Gabby and Vanessa as well. It's been a fantastic webinar, so well done and thank you very much. Thanks, everyone.
It was very quiet.